Welcome, dear viewers, today on our health television. Today we are talking with our experts from the Biomed Center Sonnenberg about the topic of type 2 diabetes and, above all, how we can view this topic in holistic biological medicine. For this, I naturally have our director with us, Dr. Thomas Rau, but also an employee, a new doctor whom you will meet today, Dr. Jürgen Strein. I am very much looking forward to both of them focusing on this very self-fabricated metabolic disease with a holistic perspective. See you soon. Hello, everyone. Nice to have you here. Now, of course, right in the introduction I thought, oh God, now I have self-fabricated. Well, that is, of course, the exciting thing about type 2 diabetes. Perhaps, Thomas, I'll just start with you. It can be so nicely self-regulated just as it was acquired, or am I wrong?
Yes, dear Corinna, thank you very much for allowing me to come to you again and again. You could give my lectures yourself. You already know so much.
Yes, type 2 diabetes has been my passion.
So type 2 diabetes, for us, it is a condition of its own, a metabolic syndrome. I know that's a modern term to look up on the internet. The metabolic syndrome, which can express itself as a weakness in glucose processing, is type 2 diabetes. These people then receive oral, that is, anti-diabetic tablets, which work quickly, and then the blood sugar improves. Or very often they eventually receive insulin supplementation. We have many patients who come to us. Can we cure this on our own, biologically, or with natural medicine? To answer this here, I really have to say yes. But, and the but is the important thing, when I see these people, so who comes to us in Schwelbrunn, in the beautiful pre-alpine region of Switzerland, eastern Switzerland, who is already coming to us? These are all people who have already had a long history. So practically everyone. I have no newly diagnosed diabetes 2. No, these are those who have already been everywhere or at several places.
And of course, they also have the aspiration to become healthy responsibly. I think that is certainly also a step.
That is the absolute core sentence, the aspiration to become responsible. Our people are instructed, what can they do themselves? That's why our people, when they do that, get so much better that they don't have to come to us often. We see that very often. The diabetic starts with more intensive initial treatment, but as an outpatient, most of the time as an outpatient, and then over time it gets better. We really have an almost 100% success rate if people participate. Well, I don't want to undermine anyone. You are not participating, and that's why. No.
Excuse the very brief interruption, dear viewers, but we would like to let you take part in a small excerpt of a special broadcast that we have briefly summarized. And if you would like to watch the entire broadcast, you can find the corresponding link in the description below. Enjoy.
After what we've been through for 3 years, we have a significant inflammatory load in the body. And due to this inflammatory load, massive circulatory disorders occur at the vascular level. The OHT is a measure that plays a very important role in all chronic inflammatory processes. We also notice that this reduces the toxic load significantly. You regain a piece of health bit by bit.
What do we see in these people? We measure insulin antibodies. And we see these poor people have antibodies against their own insulin, and therefore cannot process sugar at all. This has nothing to do with the pancreas. This is a liver disease, a metabolic liver problem that produces antibodies. Or a bowel problem. Then what does the human need for insulin at all? Insulin processes the blood sugar and brings the blood sugar into the cell. What does the insulin or the insulin receptor need? Our medicine is deep pathophysiology, is microbiology. So this is the most advanced medicine. This is not some kind of dreaming, nature dreaming. No. So it needs chromium. Chromium is a trace element, which nobody talks about. But it is absolutely essential to make insulin effective. We have chromium antagonists in our environment, dear patients. And this is the chlorine in the water, a halogen. If you drink chlorinated water long term, then your chromium, which you need to process sugar, is antagonized. This means it no longer works properly. Just by the way, it's similar with fluoride, with the nonsensical fluoride tablets that are already given to children for tooth enamel. What nonsense, that is toxic. Similar also with iodine. Iodine is also a halogen, also a trace element, needed for the thyroid. We have so many thyroid patients. Well, you see, we are on a quite mechanistic level. This has absolutely nothing to do with psychology. No, we have problems here. And so insulin can no longer be processed. And then the blood sugar rises. That's a cause.
What I also find nice now, because you look at it holistically and see what do the medicines do. Especially B12 thieves with metformin, where you really see the patient deteriorating cognitively so much that you think they're even heading towards dementia. But they just have a secondary damage from a medication. And that is completely ignored. And then you ask a general practitioner about the homocysteine level. They look at you as if they've never heard of it. Then the Googling begins.
Exactly. Our patients who come to us are not diagnosed at all, even if they have been under specialist treatment. With diabetes, it is really bad. It's not just, now comes the second level. It's not just the wrong eating. I'm a bit allergic to just saying, yes, they just eat incorrectly, and so you just have to eat differently. Then everything is fine. Unfortunately, that's not true. It's important to eat correctly. But what else do you need to know? Sugar intake is, now hold on to your chair, sugar intake has increased tenfold since 1980. But it's not that people now consume 20 sugar cubes instead of 2 per day. No, the sugar intake is hidden in value sugar, cornstarch, corn syrup, sucrose, fructose, all of these substances which are in practically all processed food products, not just in soft drinks. They cause insulin resistance. It's really devilish. And people don't even know that. Therefore, they must learn to look at the packaging leaflets of food. Is sucrose, for example, written there? Or does it say invert sugar? Or mostly, it's already sugar, so it's no longer written, but corn syrup. From cornstarch. Great corn is healthy. Yeah, no, that's a super cheap sugar that is put everywhere. So these are things where we explain to the patient when he comes to us what he needs to watch for. It's not just about, yes, you eat too much or you drink too much Coca-Cola. So we're not that simple-minded anymore. No, it's much more hidden. And if you break it down and also, as you mentioned, replace vitamin intake, that's orthomolecular medicine, then the metabolism adjusts. We can stimulate insulin again, the effect of insulin.
I also know, of course, you pay very close attention to the gut. I recently had another case, a woman with intestinal fungus, bloated, fermented flatulence, elevated HbA1c, liver, where I think she gets on Formin, it's linked to diabetes. She simply has an intestinal fungus that ferments and ferments and ferments. There was 0.0 attention paid to it. And when you regulate it and you have great methods for that, then it's gone. But of course, there is also extreme craving for sugar, because we know that naturally regulates your brain. You sit there, you can't not eat sugar because your gut has you completely under control.
Yes, but it is an interesting self-experiment that everyone should try, just to avoid free sugar for a week and see what happens to the body. Usually, it's such that the cravings generally disappear after about 3 to 4 days. And after a week, it's over. There are no more cravings. That's interesting. And when you watch how you eat, then first sweet, and 2 hours later, something hearty and salty is eaten again. And that keeps this cycle alive.
Exactly. We see with us, we have many people who come to us and stay for a week in the beautiful hotel or 2 weeks. And they practically always tell us, oh, I sleep much better, I can think better, I have no more bloating, and so on. Why? Because, well, they come for something completely different. Be it joints, be it rheumatism, be it whatever. No, they have our vegan, sugar-free, gluten-free diet. We are vegan, sugar-free, no sugar is used with us, and gluten-free. And then people are amazed. Wow, you don't even notice it.
You don't have cow's milk either, right?
Vegan doesn't include cow's milk.
Yes, I know that, but you guys also don't use anything now.
0. So cow's milk and cow's milk products are not vegan. That's a particularly problematic story nowadays, because cow's milk has changed a lot. We avoid them 100%.
What does that look like? We repeatedly have the discussion about the amino acids, which are the key. Also, with type 2 diabetes, we have such extreme muscle loss. Eventually, we have the thin arms, thin legs, and here the little belly. These are then so, especially with men, for example, you can see that naturally. How do you deal with these amino acid issues? Who is rebuilding the muscles for you? Because the decay is evident.
That would be a show in itself. The supply of amino acids. Humans do not supply amino acids, they supply proteins. And the proteins are built from amino acids. The average Central European consumes about 130 grams of protein per day, but they can only process about 70 grams if they are really good metabolically. They end up with an excess of protein, like a glue that infiltrates the tissues and then results in an excess of protein. In other words, an excess of amino acids which are not processed. This is then called an over-acidification. It is a liver problem. Those who lose muscle mass develop such a belly, they have a liver problem. a metabolic problem of the liver.
And enzymatically, they are not at all able to break down proteins into amino acids. And then it comes out undigested.
That's the problem. And we're back to the intestine. You can do that. Where are the proteins broken down? In the small intestine, down to the amino acid level. And if that doesn't work for various reasons, we can test that. We can test the patients to see if their small intestine is working or not. Then they just get all the problems. Among other things, type 2 diabetes.
Jürgen, what would you recommend if a viewer says, "It makes sense to me, I have previously had a diabetological treatment that apparently was aimed at adjusting my blood sugar levels. How can it be with you? If I say I'll come, do I stay a day or two? Is one configuration enough?"
It is also very individual there. There are patients who are very well prepared before they come to us. Ideally, they already have a plant-based diet. They have enough exercise. In that case, you would look at how the liver burden is in order to stimulate the liver's metabolism, to increase ventilation performance. This can also be focused orthomolecularly. You can also focus on it neurotherapeutically, for example, when important acupuncture points treated in the abdominal area. One can significantly enhance the metabolism and clearly support the therapy as well.
We had a separate program on neural therapy. However, I would like to emphasize again that you're not doing a classic independent neural therapy, but also integrating and combining homeopathy and acupuncture, where I then have active ingredients that are really specialized on type 2 diabetes or the intestinal flora.
It's the case that ultimately, for the neural therapy, we select the Sanum products, that is the homeopathic remedies, which are then specifically used in the region and also specifically support the metabolism.
Right now, also in the hereditary aspect. Naturally, we do have this topic put somewhat in our cradles. It is said that type 2 diabetes, especially if it runs in the family, is because the insulin receptors are weakened. Can I now, if I know it's present in the parents' or grandparents' lineage, already work preventively? That I say I actually want to not even pave the way to the well for the child.
Yes, that would be good. We have metabolic families. That really gets inherited to some extent. We call it a constitutional type. And the constitutional type, you are just born with it. And then you have to know that you have to act against it, or accordingly. It is certainly difficult for an adolescent or a child to understand that. I'm healthy, my grandfather had this and that. But recognizing that he is already heading in that direction, that's difficult. We try, of course, to pass that on through rethinking, but that's unfortunately the way it is.
Yes. Well, there is now, how should I say? I can also say, I also have on the father's side, on the mother's side, I also have on the father's side, complete type 2 diabetes. And I've, of course, holistically also taken care of the employees, the large corporation, on the topic. Of course, there's also, and I certainly enjoy Alexandra's work with you, the sweetness of life. Where do I not live the sweetness of life? Where do I also compensate for the joys that I cannot accept or live? And our generation now, let's say 40, they are really in a position to say, okay, I am aware that parents and grandparents are type 2 diabetics. But at least I can say now, I get my HbA1c checked, or maybe I already notice when I eat pasta that I become completely exhausted, unable to concentrate. There seems to be a regulatory disorder if you already notice something's amiss.
Yes, although I would say that even with diabetics, we don't really like to have low carb, because it can actually make the values worse with insulin therapy. It actually does, if you do everything in moderation. Also, with us, fruits are allowed in the diet, if they are consumed in moderation. It should not go to the extremes in diet, like with low carb really, and then mainly adding fats or proteins. That's not the point.
Yes, that's already exactly one must clearly say in the German Society for Nutrition, when we then got the duty to advise after our studies. So if I had done it, which of course I did not, you get crisp bread and margarine as a diabetic. And only if you now, I say, this whole grain battle, sometimes pretzel sticks as a snack. So, sorry, that's not low carb if I avoid such junk. Fruits, well, that's not an issue, it's still low carb if I then choose berries and such. So there's still a lot of education needed, and there's so much manipulation because we, of course, also have regulation systems. Only if we consult like this, we can charge via insurance. Seriously? As a moderator, I actually shouldn't talk so much about this. I'm neutral again. Yes, because it's just a topic.
So I don't want to go into billing because it's completely entangled. But for example, we offer quite a lot of carbohydrates, but these are long-chain carbohydrates from vegetables, and it takes several hours for them to break down. And that's the important thing. You have a very balanced blood sugar. Well, we are not for low carb, so eating few carbohydrates, that's just not true, but rather balanced plant-based nutrition. Now, I've said earlier, we are gluten-free, sugar-free, and I know what else, vegan. Yes, why do we do this? People with chronic illnesses, very, very many cancer patients too, autoimmune, severely sick people, come to us, they stay for 1 to 3 weeks. We have to change their metabolism during this time. That's why we do this intensive program. In 1 week, they have changed their metabolism, and people agree with us on that. Not because I am now a sectarian vegan or anything like that. No, we simply know 60% of the population, especially the sick population, has problems with processing gluten. Over 90% of sick people have problems with converting milk proteins. From cow's milk, the beta-lactoglobulin is simply not processed correctly. That is the problem, and that's why we do it. The people for 1, 2, 3 weeks away and call, oh, I'm doing much better. Then I can advise them on what makes sense to continue doing at home. I don't say you just have to keep eating like this at home. No, a plant-oriented diet, at the same time we build up their entire trace element and mineral and vitamin balance so that the metabolism gets going again. In 6 months, if the people participate, type 2 is compensated. We can really say that, I believe. And then you come with your ganglion injections and your neural therapies, which I also do. It's just brilliant because it goes much faster.
Super.
Ultimately, neural therapy can be used for all chronic diseases to reduce the sympathetic nervous system and ultimately then have a good influence on the chronic disease.
It is also key in cancer and such to get the patient back into the parasympathetic state. And everywhere, in all disease contexts.
Absolutely.
So basically, you're not really harming yourself with it.
We know one of the main causes of cancer is chronic stress over years. And interestingly, we also see this in the VNS analysis, meaning the analysis of the autonomic nervous system. We always do this upon admission. You can see the significant differences when you do another analysis before the patient leaves. And in most cases, there have been quite a few changes.
Great. Super. Thank you very much for the overall overview, and I am always happy when you're here. A wonderful topic, because it's really something that one can regulate themselves, and thus it is really fun to work with the patient if they are willing. And they can reintegrate the joy and sweetness of life on the real side. Thank you, both of you.
Thank you very much.
Dear viewers, yes, type 2 diabetes, an important topic. Again and again we had wonderful guests for this. A holistic view also integrated with neural therapy and many other important building blocks. And I hope you were able to take quite a bit away. Thank you for watching. See you soon. Goodbye.
Thank you for watching Swiss Health Television, QS24. Please don't forget to subscribe to the channel below or watch all our shows ad-free on WikiSana or to enjoy this selection of programs. I wish you all the best. Until next time, and goodbye, everyone.